Global Alliance for Behavioral Health and Social Justice has been informing policy, practice, and research at the intersection of human rights, social justice, and behavioral health since 1923. Welcome to Normalize the Conversation. I'm your host, Francesca Reicheter, and today I'm joined by Gita Jaffe, Director of Programming for the Global Alliance for Behavioral Health and Social Justice. In this episode, we learn about the Global Alliance for Behavioral Health and Social Justice's mission and 3 important initiatives within the Global Mental Health Task Force. Thank you so much for joining me today. I'm really excited for our conversation and to get to learn more about the Global Alliance for Behavioral Health and Social Justice. But before we begin, I just want to check in. How are you really?
Well, hi, thank you so much for having me. I'm excited to be having this conversation with you, and I am truly and honestly honored to be able to have this conversation with you, and I'm excited to get going.
Awesome. I'm really excited because we connected a few months back, and it was really great to hear about an organization that's focused on that intersection, right, between research and behavioral health, social justice, well-being. There's not, I don't want to say there's not a lot, but there's not enough conversation really connecting behavioral health and social justice. And it's really, really hard for us to move forward as a society, as a country, as internationally. It's really hard for us to move forward when these conversations aren't being held. So I'm really excited to share more about the Global Alliance. Can you tell us a little bit more out of the mission behind it?
Of course. So again, thank you so much for having me on behalf of the organization. So the Global Alliance for Behavioral Health and Social Justice is actually 100 years old. So in 1923, it began really as a way of looking at how are the children and what is happening with them? How can we better serve our children in our communities? And so it really has been since 1923 an interdisciplinary group of thinkers that want to inform policy, practice, and research at the intersection of human rights, social justice, and behavioral health. And in that sense, behavioral health is mental health, substance use, and health behaviors. And so we've always really looked at mental health and well-being across the continuum. So from promotion and prevention through to recovery, understanding that everybody has mental health and that we move along the continuum depending on what the issues are. While some people have serious mental health disorders, we all have mental health. And so it's truly important that we look at our systems and settings in order to improve outcomes for all individuals and populations.
Yes, it is so important to recognize we all have mental health and it is a continuum. Sometimes we might be doing a lot better than other days. There might be different events that trigger a decline in our mental wellness. And to recognize that we're all vulnerable to struggling, to not having the systems in place to be able to support us. So by recognizing that these conversations need to be held and we need to be looking at it from a place of all of us instead of just the population that we've decided is struggling enough to get our attention is huge.
Absolutely. And I think, in that, here we are talking about normalizing the conversation. The understanding that we all have days that range. Anxiety can be normal. It is a normal part of life, but we ought to be learning coping mechanisms for ourselves, for our relationships, for within our communities themselves. It isn't automatically a concern as long as we know how to think about the promotion and prevention. Serious disorder is a separate mental health disorder is a separate way of learning coping mechanisms that are true to the circumstances that each individual has. But for people to go through a range of emotions does not necessarily mean that they are someone with a serious mental health disorder, but everyone ought to be accessing health promotion, health prevention, and a better understanding of how to be well themselves, understanding that there will be phases of all of these different experiences. And this is something that is truly important, especially as people are raising awareness around what these emotions might be and what some of the symptoms and outcomes can be.
Yes, learning these coping skills, these resilience tools are so important. I remember growing up having so many moments where I felt like I couldn't catch my breath, where my heart was racing really fast, and I'd end up in the hospital convinced I was having a heart attack. And no one had talked about the fact that these are symptoms of anxiety. Whether or not it was diagnosable at that point, these were symptoms that I was not having a heart attack. They never could figure out anything physically wrong. But internally, my heart was racing really fast. I felt like I couldn't catch my breath. My palms were getting really sweaty. All these symptoms were happening, and no one kind of taught me how to calm it down in the moment, how to manage it. So as I got older, it continued to get worse because I never had the tools, because no one was really having these conversations. So to be looking at our children and how we can start equipping them with the tools at a young age can make such a difference in their mental health and how it can progress from symptoms that we're experiencing that are part of normal emotions. Like I was getting really anxious for exams. I was getting really anxious about the idea of failing, or very anxious about making friends and connecting with people. But without any of the tools, those anxious emotions kind of built up into a point where at every single thing started to trigger these moments where I would end up in the hospital once a week, convinced that I was having this heart attack. So it's really important that, I mean, just looking back on my own journey, we start equipping children with the tools, regardless of whether or not it's a diagnosable disorder at that point.
I mean, yes, and I think that we need to really, and this is some of the work that we do, is that we look beyond just a traditional mental health system. There are strengths within every community that we ought to honor. And thinking about promotion and prevention through to recovery and the role and responsibilities and opportunities that every individual and group within a community has in order to support the well-being of themselves, their families, their networks, their communities is really pivotal in having populations that are well. And so that's one of the things. I mean, we do a lot of work to inform policy, practice, and research on understanding this intersection of human rights, social justice, and behavioral health, and informing policy, practice, and research, bridging those silos so that that policies aren't in a silo and research is studying something else. They ought to all be interconnected. And so that's really one of the unique aspects of the work of those involved with the Global Alliance. What we do is we really work to bridge those gaps and think comprehensively and holistically about what moves to well-being for all toward mental wellness. And really supporting people where they are at, and the strengths that each individual and group has within the community, because we all have an opportunity to contribute in different ways for ourselves, for those around us, and really honor the strengths and the needs of the communities themselves.
It is really difficult when practice, research, legislation are all heading in different directions. And without that communication, without bringing it together, it does leave a lot of people behind. And we need to be working toward a system where we are supporting and creating these networks of support for everyone. Can you tell us a little bit more about the Global Mental Health Task Force and some of the things you're working on right now?
Sure, yeah. When we sort of had a bit of communication beforehand, you asked me to think about three recent, I guess, products or priority areas that the Global Mental Health Committee specifically was working on. And so the first one I'm going to talk about really was a pivotal white paper. And so it is called Reconceptualizing the Mental Health Workforce, a principle-based white paper with strategies for operationalization. And really, this brings out and recognizes the opportunities within all of our systems and settings and communities, really understanding that to truly reconceptualize the mental health workforce, you need to understand that there is a role and an opportunity for everyone involved. And so in order to do that and emphasize the natural strengths and supports that are available, it really does consider individual and population well-being for all. And so there's three critical components that are within this paper in terms of the approaches. So one is task shifting and task sharing. So understanding what part of the continuum you're talking about, whether it's promotion and prevention through to recovery, understanding and leveraging community supports and resources, and enhancing the infrastructure that exists. And so what we use is a principle base, which is meaning that it's grounded in human rights. And so the four principles that were identified in this paper and discussed sort of with clear strategies for actualization are to represent balanced investment across the lifespan and mental health continuum, including health promotion and prevention. And so by across the lifespan, we mean from as early as prenatal all the way through to older adults, and really understanding that at every aspect of your life, your needs might be different, and also that your strengths might change throughout the different times, as well as others within the community. Support, resources, and care must be strength-based, person-centered, and community-supported in all settings. And so really looking beyond the traditional mental health system and incorporating the mental health system, as well as green spaces, as well as school settings, as well as faith-based organizations, as well as community groups, as well as all of the other infrastructural settings that exist within a community. The third is support, resources, and care must be accessible, culturally sensitive, and appropriate in all settings. So really looking at the strengths and needs of the community itself. This is the way when communities are identifying both their strengths and their needs that facilitated responses make the most sense and have the strongest outcomes. And fundamentally, this is critical in terms of all the work that we do, and that's that mental health must be centered within and across systems and settings. And that's to say, you know, from a policy perspective, when making policy decisions on, let's go with something broader, the requirement to have sidewalks, understanding that sidewalks and subdivisions are critical to enhancing social connection. If people know their neighbors and have opportunities to be on the street, walk to a local place, walk to their friends, it has an increased potential to have engagement with community members, to have purpose, to have these other types of relationships. And so really thinking about how do decisions, whatever they are, in whatever system or setting that you are discussing, what is the impact on individual, family, and population well-being within the community? So that's one example of a recent priority area that this committee has been working on. Another one, again, this was raised by committee members themselves, was to develop guidelines for conducting global mental health research. And so what a subgroup of this committee did was really develop a set of specific guidelines for global mental health research from an interdisciplinary perspective that is grounded in human rights and thinks about emphasizing community collaborations that are ethical, sustainable, and culturally appropriate. those guidelines are available and are really important for people that are considering doing any type of global mental health research, particularly if in interdisciplinary settings. And so along these lines, the committee then also hosted a live conversation or webinar, which you can also access off of our archives, which really explores the application of these guidelines in Panama with interdisciplinary members that were working to actualize and implement these guidelines and sort of structures in terms of how to collaborate ethically and in a manner that has sustainable outcomes and that is appropriate to the communities where they're working. And then the third example that I have, which you'd asked me for a third one, is our global advocacy. And so we have done over the years a lot, but you asked me to center it into more recently. So in the last, let's say, 3 to 5 years, we've done a lot of international global advocacy representation in a number of different types of global meetings, whether that be just a lot of them, because so many have also opened up virtually. We've had a lot of representation at a number of key meetings, from high-level meetings of the UN to specific topics, world conferences, and so on and so forth. So a couple examples of things that we are really strongly advocating for with other organizations and coalitions as well, such as the Global Mental Health Action Network. We really advocate a lot for the inclusion of mental health and universal health coverage. And this is critical because the majority of the funding for universal health coverage and the discussion has had mental health on the lower scale or negligible. It is increasing and improving due to the advocacy efforts of organizations such as the Global Alliance to really improve and increase decision-making powers to incorporate mental health and well-being, to achieve Sustainable Goal 3, which is focused on health and well-being. And also related to that, we've done a lot of advocacy in regard to inclusion of mental health and psychosocial support in HIV and AIDS programming. And as well as, most recently, we've also done a lot of work on mental health and well-being in pandemic preparedness and associated international instruments. So the current doctrine, we've done a lot of global advocacy in terms of incorporating mental health and well-being in terms of prevention preparedness. And this is critical because while there's a lot of surrounding and understanding of other aspects of prevention preparedness, one of the items that was clearly not considered until partway through the pandemic was the impact on mental health and well-being. And so what we are trying to really advocate for is to think about centering mental health before things occur, really thinking about the promotion and prevention components. And also, as decisions are being made moving forward, what are we considering the mental health and well-being of individuals, families, and communities?
You can see with everything you broke down, mental health is at the center. It is so important that, I love the idea of the sidewalk, right? That example. Everything we do is connected to our mental health in some piece and has the ability to provide support and provide preventative measures by being able to engage with your community and feel connected in a sense of belonging is so important. Looking at schools and making sure when a kid is at school, they also have that support system in place, that they are gaining the tools that they need. Looking at when they're home and in their communities, what support are we providing to them? Looking at health insurance and making sure it's covered and people can actually access resources and support. It's creating all of these, what might seem like small things, like adding some mental health education into schools, right? Putting some just conversation on coping skills or self-care practices, or making sure there's enough space on the sidewalk for people to walk next to each other, or making sure someone can access just a few more therapy sessions a year. Things that may feel so small really add up to that prevention, to that preparedness, so that when before someone needs help, all the tools are already in place.
And when
Yeah,
and when someone needs help, that the appropriate tools are available and resources within communities based on the strengths of the communities themselves.
it is so important that we make this accessible and that we have these conversations, because a lot of people don't realize how inaccessible it can be. A lot of times, the conversations I know that I had been a part of growing up was like, if I was having these symptoms, it was easy for me to go to the hospital and get checked out once a week. A lot of people don't have access to be able to go constantly to the doctor and get that support. I was able to access therapy post psych ward 4 times a week. A lot of people don't have that access. So being able to recognize the infrastructure in place and what we're doing to provide support, not just to the people who are privileged to have access, regardless of what's blocking them and what barriers could be there. The people who those barriers are actually really preventing them, and making sure we start breaking through those barriers.
Yeah.
So, as we are wrapping up, how can people get involved with the organization and provide support?
Well, there's lots of ways. It really depends on what people want to do and what type of call to action they want to respond to. We have an upcoming symposium that will be actually in Chicago in September 26th to 28th, which is called Coming Together for Action. If you are able to travel to Chicago, or if you're in Chicago, I recommend taking a look. There are lots of opportunities to become engaged and listen, learn, and become active and work together with interdisciplinary thinkers that want to move forward to finding solutions to enduring challenges that our communities face. We have membership, and with membership, you can become actively involved in our task forces and committees. And so we have a number of them. They're all described and discussed within the website. And so I really highly recommend people take a look if you're interested in what I've been discussing or some of the other opportunities. That's bhjustice.org. You can find lots of information about membership and about ways to get involved. We have an academic journal as well, which is also listed. Our principal publication is AJO, and American Journal of Orthopsychiatry, and it really has very key research that is thinking about the intersection of human rights, social justice, and behavioral health. And so there's lots of very interesting research that's developed regularly, and all of our policy products are published and archives within our website or links from our website. So to find out more about any of these projects or other projects and priorities that we've worked on, you can take a look and really come together and work on the areas that you can, whether that's as an individual in your community or with others. We all have strengths and we all have experience and expertise, and it's about coming together to find solutions to the enduring challenges that we all are facing within our communities today.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.